This is James. He has volunteered to be my patient today. We are doing the skin, hair, and nails assessment. We are looking at his skin tone. His skin tone looks even. He's a Caucasian male with some pink undertones. He has several nevi scattered across his entire body. His skin uniformity, it covers his entire body and is intact. The thickness, he does have a stage 2 to his right buttock with several other stage 1 lesions from a recent MRSA infection. Let me see the arms here. So he has several lesions that are covering his body that are in the process of healing. He has been on long-term antibiotics for. He does have other scattered diabetic lesions that cover his body, primarily from acne. He has some ineffective wound healing, but his feet have been inspected and they've been noticed without any lesions. He does have some calluses on the soles of his feet. He is clean shaven and without any body odor. He has a scar that is on his lumbar sacral area from where he's had his spinal fusion. He does have some limited mobility from that, which does impair his skin integrity. Hence the stage 2 decubitus. The lesion characteristics, he has a stage 2 to his right buttock. Noted that dime-sided. It has a regular border. Has induration, yellow escudate to the wound bed. Has no odor. He has another one to the left buttock that is has some scarring. It's recently healed. Stage 2 is now staged as a stage 1. The area to the left has no induration, but the one to the right does. He has scattered lesion. He has several scattered lesions that are stage 1 across his body, as I mentioned before, from like acne scarring, the recent MRSA infection. He is a non-compliant type 2 diabetic. He has a lot of improper wound healing. He has been on long-term antibiotics of ciprofloxacin and metronidazole for probably 6 months or better. His skin is warm and dry to the touch. It's smooth as even. And as far as the skin tugger goes, it is noted to rise and return to shape without any tinting. Let's see. His hair and scalp, he is soft, is clean, is thick, short shaven. Scalp is noted with several diabetic lesions from unhealed acne scarring. Color of his hair is brown. His distribution is even, and the quality is normal. Nail inspection. His nail inspection, he has, his nails are short, the nail edges are rough, they are dry and cracked around the outer surface. Nail bed is pink, and smooth, and he does have some early signs of clubbing. He has COPD and some obstructive sleep apnea. The firmness is also the nail bed is also firm with palpation, and the nail bed thickness is uniform, and the texture of his nails are smooth. Okay, moving on to the head and neck assessment portion. His head is centered, it is midline. His accessory muscles are symmetrical. His head is able to be held erect, and he's able to hold his head still. His facial features are symmetrical. He does have a little bit of a flat affect. His skull is round and symmetrical. As I said before, the scalp and the hair, he does have several diabetic lesions that are still in process of healing. Temporal arteries, they are palpable on each side with no apparent distension. His temporal mandibular joint, open and close your mouth, is freely movable without any clicking or rubbing, indicating any signs of TMJ. Salivary glands. His mouth is pink and moist. You can see that he does have some salivation inside of the mouth, and there is no lesions. Okay. As far as the neck and neck muscle inspection, palpation. Neck muscles. Let's see. The head and neck is midline. He has, turn your head this way. He has full range of motion. He's able to move it up, back, down, hyperextend, extend, flex, hyperextend, and flex. Flexion, okay. Extension, okay. Without any complaints of pain. His hyoid bone, thyroid, and cricotcartilage are palpable without any enlargement noted. Trachea is midline. The thyroid has no obvious abnormalities of enlargement. Let's see. Upon inspecting the thyroid tissue, I'm going to ask you to swallow. It'd be easier to do from the back, but holding the camera, I'm not able to do that. Be able to feel the thyroid. Swallow. Swallow again. Okay. Thyroid is able to move up and then fall back into its resting position. Patient is setting up very straight, and can you hold the camera? If it's palpated from behind, swallow again. The thyroid moves freely and is palpable with both fingers on the side of the trachea. Swallow again. And the trachea and larynx move freely as the patient swallows. Okay. And then to auscultate. Would auscultate the bell with the bell of the stethoscope, listening. Should hear soft, pulsate, whooshing, blowing sounds without the presence of a bruit note present. Okay. The lymph nodes of the head. Want to use a circular, gentle pressure to palpate the lymph nodes of the neck. going to start with the the posterior auricular, and then the occipital, and then the jugular, gastric, and then the superficial cervical, and then the pre-auricle lymph nodes, submandibular, submental under the chin, deep cervical chain, palpating all the way down into the supraclavicular area, and then your post-cervical lymph nodes. And all those are freely movable, discrete, no enlargement. They're soft, they're tender. Okay, and then to do the epitrochlear node, you would turn your arm this way, like here.
Okay.
Okay. Just relax it. Just hold it up. Okay. You would elevate the arm with 90 degrees elbow flexion, and you would palpate just below the brachial, 3 centimeters below superior to the brachial artery, and toward the elbow crease in a gentle circular motion. Then you would palpate anterior and posteriorly the axillary nodes, and then in the femoral area you would palpate the inguinal lymph nodes, and all those are without any enlargement noted. And I think that concludes this assessment. Thank you.